Hello, good afternoon, everyone. I guess you can hear me, everyone.
Good afternoon.
Good afternoon, yeah. Thanks
Good
very much.
afternoon, loud
Welcome.
and clear.
Okay, that's right. Thank you. Welcome to this webinar, which has been organized so that we can share information, particularly on large-scale food fortification in our country, and share regional understanding of the same based on a meeting that took place a couple of weeks ago in Addis Ababa, where countries from the region gathered to look at the large-scale food fortification, particularly the data that comes out from that. It was noticed through that meeting that, of course, we do have data, but the custodian of the data is not clear. As a result, accessibility to that data for us to make any meaning as regards to policy formulation, strategies and implementation of lessons learned and the solutions coming out from those lessons learned, that's not clear, which is of course with our country Malawi at the moment is a true reflection of what is happening on the ground. Considering what is happening regionally and what is happening in Malawi, we do have challenges on accessibility to this data, particularly who is the custodian of the data. It's supposed to be the government, but does the government have the data on large-scale food fortification? We don't seem to have that in our custody, but the individual factories, producers of fortified foods do have the data with them. Only that we didn't strategize on consolidation of the data and make meaning out of it after analysis and produce good plans from the arising from the data, such type of data. Of course, because of that meeting that happened at Addis, that's why we have organized this webinar, so that we can share the lessons learned from Addis and search ourselves in line with the lessons learned and see how we can move forward so that we have a compendium of data that we can look at and formulate policies in line with what is supposed to be done with the outcome of the data. We do have challenges, I should admit, in Malawi. The challenges are arising to that, of course, we do have legal statutes to enforce fortification standards. We don't have, particularly in nutrition. We have had a food and nutrition bill that has been outstanding for quite a long time without seeing the doors of parliament for enactment as a law, through which we could enforce some of the fortification issues in the country. As of now, we do depend on the Malawi Bill of Standards, fortification standards, that we use to, persuade manufacturers to fortify. If we had this food and nutrition bill enacted as a law, what we would have come up with were regulations in line with the legal statutes enacted, so that we can use these regulations to enforce fortification standards in our country. And again, we could also use these regulations to come up with guidelines as regards to fortification in the country. In that way, we could fortify what the Malawi Bill of Standards is also already doing to enforce standards on fortification. However, using the policies which we have, the food and the nutrition policy, the multi-sector food and nutrition policy, we have persuaded companies to fortify. For example, in 2011, we persuaded the sugar manufacturers, the Ilovo, to start fortifying sugar with vitamin A, which we saw happening. And using the policy again, all manufacturers of cooking oil have been persuaded to fortify the cooking oil. So two maize millers have also been persuaded to fortify their maize with any fortificant they can carry. Of late, we have a project where we in fact has a compendium of so many stakeholders within it, including GAN. We are trying to venture into hammer mill fortification. Of course, we do have the fortification regulations from the standards from the Malawi Bill of Standards. However, what we remain with is maybe to draft a guideline on how the fortification will be done using the hammer mill, so that this can guide the maize millers to make sure that they don't go astray in the fortification. So these are the things that Malawi is currently doing. Now, of course, if we are asked, do you have data of what the sugar producers are doing as regards to fortification? As a government, we might hesitate because custody of such data is within the Malawi Bill of Standards, who monitor the standards, and as well as the manufacturers themselves. But we don't have an outright custody of that data. Of course, we have the National Fortification Alliance, which is a baby of the Ministry of Trade. I'm not sure about their engagement to the fact that the ministry itself has to be a custodian of such data. These are the things we are supposed to be engaged with today and see how best we can, move around so that there is an outright, custodian of that data, where we can say if we want such data, go to this office and you get that data. If you are coming up with strategies regarding fortification, this is the office that will provide the data and guide your formulation of strategies in that line. So these are the things. Before I hand over the mic to EXA, let me, on behalf of the government of Malawi, thank EXA for this initiative to make sure that we congregate today and share the information regarding the regional dialogue on data that happened in Addis Ababa, so that Malawi also can benefit, and all the stakeholders in fortification in Malawi can also understand the need for data. And together we bang heads and see how best Malawi can do so that the data is available in a manner that everybody can access. So, EXA, on behalf of the Malawi government, thank you very much for coming to our support in this regard. And I hope this is not the end of your support. You make sure that whatever is agreed today, you follow up with us and assist us so that what we are talking about today materializes, and Malawi has a database for large scale food fortification. In fact, all fortification, a database of fortification issues in Malawi. Thank you very much. Over to you, Exa, for your remarks. Thank you.
Thank you very much, Mr. Mualo Blessing, Director, for inviting everyone and for taking us through what Malawi is doing. So my name's Doreen Marandu. I'm working as a Senior Program Officer at EXA in the cluster of nutrition, mental health, NCDs, and food security. But before I go through my presentation, I know my cluster manager is in the call. May he be able to give few remarks? Dr. Jones Masie, over to you.
Yeah, before Dr. Masie comes in, may I also ask that we have a point where everybody should introduce himself or herself on the forum. Thank you.
So, Mr. Mwala, I was about to tell you the same thing, to say you have given us a very good background, but we don't know who is on the call. So
Okay,
thank you for that. I think we need to do that. So maybe let me start. Yes, my name is Jones Masie. As Doreen has said, I'm currently heading the cluster of non-communicable diseases, mental health, food security, and nutrition at the Extra Health Community. Yes. Thank you.
Okay, my name is Jason Chigamba, Principal Nutrition Programs Officer in the Department of Nutrition. Over.
Good afternoon, everyone. My name is Dalitso Kangombe. I'm Chief Nutrition Officer in the Department of Nutrition in Ministry of Health, Malawi. Thank you.
Good afternoon, everyone. My name is Ethel Ruhanga Marugali. I'm also Chief Nutrition Programs Officer in the Department of Nutrition in Malawi. Thank you.
Good afternoon, everyone.
I'm Joseph Bitrenyibango. I'm the Deputy Director in the Ministry of Health, responsible for the National Public Health Laboratories. Thank you.
Good afternoon, everyone. My name is Aida Mundhali. I'm Senior Programs Officer, Maternal Newborn Health, Nutrition International, Malawi. Thank you.
Good afternoon. I'm Lusungu Chitete, Nutrition Specialist at UNICEF, Malawi. Over.
Good afternoon, everyone. My name is Hamilton Gondwe, District Coordinator for Nutrition International based in Mangochi. Over.
Good afternoon. My name is Gloria Kantema Jeremiah, Chief Public Health Officer, Ministry of Health, Food Safety. Over.
Good afternoon, everyone. My name is Gift Mtuba, Programs Officer, Suraida Foundation in Malawi, and I'm based here in Balaka. Thank you. Over.
Good afternoon. I'm Agnes Chinchele, Nutrition Programs Officer from Department of Nutrition, Malawi.
All right. Good afternoon. Gareth Osman from Logo Investor of Agriculture and Natural Resources. Thank you.
Good afternoon. Good afternoon. My name is Eustachio, working with XIC, Department of NCD, Food Security and Nutrition Cluster. Over to you.
Jane, we can't hear you. You are on mute. Good afternoon. My name is Philip Makumla, and I'm a fortification specialist working in a number of countries. Thank you very much. Over.
Hi everyone. My name is Jacqueline Charimela. I am working as a project manager with Safe Help Africa in Malawi. Thank you. And over.
Good afternoon, everyone. My name is Stefano Juventus. I work with EXA under the Cluster of Health Systems and Capacity Development. You're all welcome.
Good afternoon. I'm Bering Mahango, Nutrition with Nutrition International from Simba North. Over.
Good afternoon. I'm Timothy Biswick from National Fortification Alliance. Thank you.
Sorry, Mr. Moal, I'm not sure. I think everyone, we have introduced ourselves, right?
Good afternoon, everyone. My name is Margaret Kama. I'm Programs Officer working with Civil Society Organization, Nutrition Alliance, CISON. Thank you.
Sorry, Mr. Moal, may we proceed?
We can proceed. If some people are just joining me, we can see them in the comment. They should comment, just comment to say where they are from and their position from where they are. Okay, you can proceed, John.
Thank you. Thank you very much, sir. Thank you very much, Doreen and our colleagues from EXA Health Community. I know we have representatives from government of Malawi, development partners, private sector, academia. I've just seen one person whom I personally know. I don't know whether it's the same person who is from Fortification Alliance. Is it Professor Timothy Biswork? I don't know if it's the name that I recall way back, but I know it should be from academia. And everyone who is here, Mr. Philip, I know we have colleagues from Tanzania who are also on this call. And thank you very much, Doreen, for letting me maybe just say a word or so before we proceed with this. I know it's we have a large agenda, so I'll be quick. Basically, it's just to say thank you very much, Malawi, on behalf of EXA Health Community. And as I've already thanked all the partners for taking your time that we discussed together. Basically, I think as the EXA Health Community, as one of the mandates for the cluster, we know that large-scale food fortification remains one of the proven and cost-effective approaches when it comes to addressing micronutrient deficiencies. So, however, the success and the sustainability of this program surely will depend not only, yes, having policies, as we have said, or standards, but good quality and timely actionable data. Data is very important. And unfortunately, as we heard from Mr. Moore, I think he talked of, yes, there's that fragmentation, different areas where as ministry, we do not have that data readily available. So I think all we need to do is to make sure that we work as a team, maybe from industry, regulatory authorities, standard bodies. If we can share data and translate this into action, surely this will make us, achieve what we are looking for. So this is why the EXA Health Community under the Eastern and Southern Africa Regional Coordination Mechanism on Food Fortification, which we co-chair with SADC, we believe this is important. and would like to provide a platform for countries and partners to make sure that we work together, learn from one another, and harmonize approaches, and make sure that we do strengthen that accountability for food fortification across the region. And Mr. Mwalo, you talked about the meeting that was held in Addis in October. That indeed provided an important opportunity for countries to make sure that we examine our data landscapes and also identify those practical opportunities to make sure that we strengthen data collection. So in today's meeting, I believe that this will provide an opportunity for us so that we bring those discussions home now and translate those lessons. I know Mr. Chigamba, he attended the meeting. So we need now to put those into practical action. So as EXA, we encourage Malawi to make sure we should build on the existing national coordination mechanisms. And then if we can have a stronger collaboration with the other ministries and government departments, we should be able, to achieve what we are looking for. So let us take this opportunity as we move on from data collection to use and make sure that we put this evidence into action. So I do believe that in the next 1 hour, we should come up with something tangible for Malawi and the way forward. So let me wish every one of us, those kind of discussions that will bring concrete actions, commitments, and strengthen Malawi's food fortification program. I think let me stop there. Once again, thank you very much for being here, and we may proceed. Let me hand over to Doreen. Thank you. Over.
Yeah, thank you very much, Dr. Jones. And without going back to the protocol, I want to ride on what has been observed already. And I introduced myself earlier. I'm Doreen Marando from EXA. So for me, I just want to take you through where EXA stands as a regional coordinating mechanism for food fortification, but also just to recap on why data for food fortification is important and how did we derive to this kind of webinar. I know Dr. Jones has already said about the meeting that was held in Addis together with many partners, but convened by EXA under the umbrella of the regional coordinating mechanism. So Gomit, you can go next. Okay, as an introduction, just to keep everyone aware of who EXA is. EXA is a regional intergovernmental health organization that fosters and promotes regional cooperation in health among the member states. As you are aware, EXA has 11 member states, Malawi being one of them, and the institution has been established since 1974. So we are over 50 years in existence, but it has been an initiative which has been placed by ministers of health since those years, knowing that countries in the region have similar challenges, but the joint efforts in terms of tackling the challenge will be of much mild compared to individual countries alone. So that has been a placement by the Health Ministers Conference, and we are guided by the convention of the Health Ministers Conference. Next, please. So coming down to where we are, the Eastern and Southern Africa Regional Coordinating Mechanism. This is a platform that is being convened by EXA and SADC, but it has a lot of partners whom we are working with in terms of supporting both technical assistance, but also finances where applicable. And this is in order to be able to extend our support as a regional intergovernmental institution to the member states. So we have been established since 2023 as a joint mechanism, but individually we had already started the operations to support countries in food fortification, like EXA since 2002, there has been a resolution by health ministers for EXA to support countries in initiatives that are related to food fortification, as well as for SADC in the 2010 or something. They also had some ministerial resolution around it, but we joined our efforts in 2023. And currently, we are covering almost 25 countries that are in both the eastern parts, the southern, and the central of Africa. As I mentioned, we are sharing together with SADC. Apologies from the regional coordinator, Raymond Chikomba, who was not able to join today, but he's very aware of this convening. We also have a secretariat that is being led by GAIN and supported by Iodine Global Network, as well as Nutrition International. And in particular, we have the stream for data for food fortification, where Micronutrient Forum is leading this stream, and they are part of this meeting, and we have support from them. Next, Gomez. So just to recap why fortification data matters, as Jones mentioned, fortification is one of the cost-effective and impactful intervention that is meant for improving micronutrient intake in our populations. But we look at the area of data. Mr. Mwalo has mentioned as well that the data still remain fragmented. Not that countries are not doing a lot. We have several institutions which are doing many things, and they're producing data. We have the national coordination within our countries who are also coordinating efforts under food fortification. But what we are seeing, there is still a gap on how we're able to package the data, we are able to report, but also how we are able to utilize what is being gathered for informing the decisions that we have. Next, minute. Looking at the impact pathway of the data, we see that fortification decisions are only strong when the data behind them is strong. And the data will help to answer a lot of questions that our decision makers are asking. Why fortification? Why is it important? Because this is a cost-effective intervention, as we know, but there are many other interventions that are addressing micronutrient deficiency, from biofortification, micronutrient supplementation, and the like. So in this family of food fortification, how and why can we pitch as this is one of the area where the government and the partners need to invest in? So we are saying that we need to strengthen how we are reporting, how we are collecting, how we are reporting, but how are we utilizing the data? And I'm happy that my brother from the research in university, Osman, is in this meeting. I know he will give his contribution on how they are able to bring in the data issues from their perspective. Next, please. So the value chain of data, it comes from many points of entry. We can see from the program design and policy formulation, we have the population nutrition data, we have the food consumption patterns, we have the marketed industries, we have the frameworks, we have the baseline. All those form program designing, but also policy formulation. During implementation, we have the millers. Mr. Mwalo mentioned that still, apart from the large-scale food fortification, but still we have the small-scale producers, where there is a lot of data, but it has been a challenge not only in Malawi, in many other countries that we are supporting to gather the data from the small and medium-scale millers. But jointly, we can try to put our ideas and see what can we recommend to our ministers to be able to endorse some regulations or some procedural actions that can support getting informative data from all the producers, small and large scale. But we also see we have the supply of premixes and fortificants. There is where we can also gather data, because once the premixes are being available, it means there's an action being taken somewhere. But what do we know about that? So we can work with all the partners who are supporting this area to ensure that we have reliable data to inform our decisions. From M&E, monitoring and compliance, I know we have mentioned the different institutions, including the Bureau of Standards and others, who have hands-on data and control of what is being in and out, so that we have informative kind of data. But also in our M&E, as well as communication and learning, this is an area where our folks, our friends in communication, they need to work with us to ensure that they are capacitating our ability to be able to translate the numbers and the figures into what can be communicable to everyone who needs to know and have the information to make good and practical decisions. Next, please. So we have mentioned the meeting that was held last year in October. This brought together about 100 participants from more than 10 countries in the region. But the key takeaways, these cut across all the countries. And I should go one by one. The strong data value chain create credible and scalable fortification program. As I mentioned earlier, without having clean and clear informative data, the programs are not being able to be supported and implemented in a good way. But issue of integration across the patterns, or we should try as much as possible to use all the avenues that are already available to bring in the data into our national systems. Because already we have fragmented entries of data, but how are we feeding into the national system of data? And issues of continuous learning and adaptation of the lessons from different programs within our countries, but also across the countries. I will bring in issues of the dashboards that have been proven to work in some countries. So I know in Malawi, some of them are already being applied, but how can we strengthen the use of those dashboards and also using periodic reviews to have better outcomes? The issue of reliable data for public confidence, because now we are talking about the population, but what are we informing them in terms of the public health concern of food fortification? Because there's a lot of myth about food fortification, but what are we informing them, which is backed by data? How can we reduce the micronutrient deficiencies and all the effects of it, including the spina bifida, the low birth weight, and others, which are caused by lack of certain micronutrients in our bodies? And lastly, I also talk about, next please. Yeah, I think this one I touched upon. This just reflects what we had in Addis. Next. Yeah, I think I've mentioned this, but just to go on the last one, the last point is how can we explore the existing approaches and tools and other interlinkages between the secondary data to form decision-making. So as I mentioned, there are already some dashboards, there are some tools, there are resources which are being used globally, regionally, and in countries. Maybe we can look at them again as a country and see how best we can utilize. And next. As a RCM, we are available, we are committed. There are many partners who are already in the countries whom we are working with, but through the government, through the Office of the Nutrition, Mr. Mwalo and Jason, you can always extend the request on what as a country you require or need as a support. And through our coordination, we'll be able to work with the partners and ensure that that support is being gathered and available for the country. Next, please. Here, I'm just flashing out some examples of the global and regional tools and resources. Please go on. As you can see, mention about the dashboards. I know Malawi is already applying many of them, but we can see there's some tools which are available, which can be used to look at the nutrients that are being fortified in the vehicles that we are using. But also there is others which are looking at the policies and regulatory environments. We have others which are looking at how we can monitor the food fortification. And to mention, we also have the Global Fortification Data Exchange, who is one of the big partner within the data space in our RCM, and they are available to provide TA whenever required or whenever needed. So anytime, just reach to us and we'll be able to work around the program of work so that Malawi can be supported. Next, please. Around coverage and compliance, I know Malawi has gone through many of them, including the Fortimas. Mr. Philip Makumula will also talk about some of the compliance issues with his experience at both the regional level, but also specifically in Malawi support. I will skip that for now. Next. This presentation will be shared and you can scan the QR code where there will be a lot of resources that can be used for reference. Next, please. Next. Yeah, as I mentioned earlier, the GFDX, this one you can do comparison either at the regional level, but also at national level. And you can pick maybe if you're looking at nutrient compound comparison. This one was specifically for East Africa, but you can also go into this tool and be able to, if you want to do the nutrient comparison, maybe with the countries that you are trading with, or for any other use that you want to produce the reports on, you can use this kind of resources. Next. Yeah, next again. Next, please. So these were just like the snapshots on what is available. And as I said, the links are being provided. You'll be able to look at, and I know you're already working on it. But just to close up this presentation by saying that as a regional mechanism, we are available. Once the discussion is done at this platform, it's a short time, but we are taking those keen priorities that you exchange and maybe deliberate at this meeting as one of the first steps that we can engage with the government and see how best EXA through the regional mechanism we can provide support technically, but also working with you to identify financial resources available within the partners in your country, but as well as the regional level. I want to conclude here and say thank you to all.
Thank you very much, Doreen, for the wonderful presentation. I guess what we can do is to have all the presentations made, and if we are to discuss, then discuss all of them at once. Now, with this in mind, now can I ask Jason to make a presentation on Malawi's large-scale food fortification landscape system and tools? Yeah.
Thank you very much, Chair, and good afternoon, everyone, once again. Yeah, as already introduced, this is Jason Chigamba from Department of Nutrition. And I'm going to take you through the Malawi large-scale food fortification, data landscape systems, and also tools aimed at strengthening data availability, quality, integration, and use. Next slide. Yeah, so these are the objectives of the presentations. We are going to look at the overview of Malawi's nutrition situation or status, and also to understand the current large-scale food fortification landscape in Malawi, identify major sources and types of LSFF data, describe institutions that are involved in LSFF data generation and management, also to review the existing data collection, management, and analysis tools, and also identify the strengths that we have, gaps that we have, but also opportunities for strengthening our LSFF data system. Next. Yeah, so as said, this is the outlook in as far as Malawi's nutrition status is concerned, based on the current statistics that we have that have just been released by Malawi Demographic and Health Survey. I'm bringing these statistics so that we understand why we need to do the interventions we are doing now, but also the data that we require in as far as food fortification is concerned. So these are not for the Malawian participants. These statistics are not strange or they are not new. We are aware of them, but maybe for the sake of our colleagues abroad, this is the outlook of the nutrition status for under 5. So in terms of stunting prevalence, wasting, underweight, as well as overweight. So this is the general outlook in as far as Malawi's nutrition status is concerned. Next slide. Yeah, so what we have seen from the statistics that we have is that our progress for child undernutrition has stalled over the years. We've come from a very high prevalence of stunting in 1992, and we with the interventions we have implemented, both specific and sensitive, including food fortification. We managed to reduce the prevalence of stunting to 37% in 2015-16, but now we have gone up a little with a 1% margin, and that shows that we are not progressing well in as far as addressing chronic as well as acute malnutrition are concerned. Next. Yeah, so this data is also not surprising in as far as maternal, infant, and child nutrition statistics are concerned. The country currently, we are saying 60% of our children 0 to 5 months are being exclusively breastfed. And as you can also see from there, only 24% of our children 0 to 5 months are meeting the minimum dietary diversity, and around 8% are meeting the minimum acceptable diet. And anemia for our women aged 15 to 49 is about 32%. So you can see that the figures are alarming, that require a lot of coordination, a lot of efforts as a country, but also need for food fortification at larger scale, and also generate data, which should now feed into the nutrition outcomes we are seeing in the slide here. Next. Yeah, so coming to micronutrient malnutrition, as already seen there, that anemia is still a challenge. If you have gone through the DHS 2024, there's different categories of the prevalences for the prevalences of anemia. There's prevalence, I've just shown you the prevalence of anemia in the women 15 to 49-year-old, but we also have a larger prevalence of anemia in under 5 children, the adolescents, and also other categories. So anemia is an issue of micronutrient deficient, which is iron, which is also a micronutrient of public health importance, and which is also we are promoting to be included in our fortification programs. So priority micronutrient interventions include IFA supplementation. We are doing supplementation in the country of IFA in adolescent girls, but also we are doing the current. We are migrating from IFA to multiple micronutrient supplements in pregnant women at their natal care services. And we are also doing vitamin A supplementation and also food fortification, as already mentioned, to try to address micronutrient deficiencies of public health importance in Malawi. Yeah, as already seen, we are focusing also on the adolescent period because this is another window of opportunity to address micronutrient deficiencies in the country. And we need to better use of our routine program data, surveys, and supply chain information that can help us now to improve targeting and also accountability on our part. Next. Yeah, our nutrition governance and policy environment is very well positioned. As we've already seen, nutrition is positioned as a key contributor to human capital and also Malawi's 20 to 63 development ambitions. Those things, you find them there. We have our policy and strategic plan, nutrition policy and strategic plan, as already mentioned by Director Mualo. That is in place. That is also talking about the food fortification issues and other micronutrient supplementation programs and all that. We have that framework in place. We also have nutrition sensitive social protection that provides an important platform for reaching out to the vulnerable people, vulnerable households that do not have adequate disposable income to support their livelihoods, as well as food availability and food accessibility at household level. We also have an effective implementation. An effective implementation that depends on strong coordination among government, development partners, civil society, academia that are here, as well private sector, as well as community. So our nutrition governance and policy environment is very strong that can support food fortification program, but also data availability, accessibility, and utilization. Next. Yeah, now coming to our main agenda, that was just the overview of our nutrition landscape and so on and so forth. Now we are going into the detail of why we are convening here in terms of our LSFF program landscape as well as program data. So our LSFF program landscape is as follows. We have currently the food vehicles, the key ones that we fortify. And these vehicles include maize flour, wheat flour, edible oil, salt, and sugar. And we also have the fortification standards, as already mentioned by the DD in his opening remarks, that the food fortification standards are there, and also the specifications are there that provide the basis for our compliance monitoring. We have a government monitoring that includes the factories, the markets, the border, and other regulatory surveillance activities. We also have a private sector producers that are important that are important sources of production and also quality control data. So this is our LSFF program landscape in Malawi. Next. Now, in terms of our LSFF data landscape, we have the policy and regulation data that is available. We also have an industry and production data. We also have the regulatory and compliance data. We also have the laboratory testing data. We also have the market and housing availability coverage data. We also have consumption, dietary, as well as nutrition impact data. So this is our large-scale food fortification data landscape that we have in Malawi. Next. So what does our LSFF data we need to do? What LSFF data do we need? As a country, we need input data, we need process data, we need compliance data, we need coverage data, as well as impact data. So in input data, we need the premix availability data, quality data, and also utilization data. In the process, we need production volumes, dosing, okay, and also international quality control. On compliance, we need samples, we need nutrient concentration and compliance with the standards that we have. On coverage, we're talking about availability of the products at market level, household access, but also consumption data. On impact, we now need to talk about the micronutrient status, the one that I already presented earlier on in our previous slides. So we need anemia prevalence data, we need dietary intake, and also biomarker data. So that is the impact, examples of impact data that we need as a country in as far as LSFF data is concerned. Next. Okay, now for all this data and everything that we have talked about, we have the key institutions in Malawi that are key in as far as LSFF data system is concerned. Number one, the key institution is Ministry of Health itself. So this one is responsible for policy as well as coordination, monitoring, and also data use. We also have an environmental health department that is responsible for regulating, monitoring, and also sample collection, okay, for testing and the like. We also have FIM, Public Health Institute of Malawi, and the National Nutrition Reference Lab, which is represented by the DD Bitirin, who is also with us today. Thank you very much, sir, for joining. So this one is responsible for laboratory testing and also quality assurance. We have the Malawi Bureau of Standards. Yes, all the standards we talked about as far as food fortification is concerned, these are the owners. We have the National Statistical Office. Yes, all the impact data we showed you, the previous data and all that, these are the guys who generate that data. Industry, private sector, yes, production is done by industry, fortification, internal quality control records. They are the guys, they are the key institution for that data. We have also research and development partners. Yes, the surveys, the data that we get from the previous data, the nutrition status data come from the surveys, the research institutions, the academia who are here. Thank you for joining. Evaluations and modeling. We rely on the research that our partners and also the research institutions are concerned. Not also forgetting the partners like We Effect, Shares, Self-Help Africa, GAIN, all these are key to this research, surveillance, assessment, evaluation, modeling, and all that. So these are the key institutions that we can highlight from here. The list may be endless, but the key ones are these ones. Next. Yeah, so this is just a diagram that is illustrating Malawi's data flow. So you have the industry or the importers there. And from the importers, you have the district inspectors who inspect the products that come from the industry. And then from the district inspectors, the districts are responsible for collecting the samples, So they do sample collection. Once the sample collections are collected, they are now transported to our laboratory nutrition lab under FIM. And from FIM, once the analysis is done, the data is shared with Ministry of Health, that now shares with the national coordinating team. And this national coordinating team now share the data with the policymakers to now come up with the policies and also actions that need to be addressed based on the data that has been submitted. So this is the illustrative Malawi's LSFF data flow so far. Next. Now, what are the existing LSF data sources? We have so many of them. We have factory records. We have regulatory inspections. We have the market surveillance records or data. We have the border inspections. Those are other sources where we can get the data. We have the laboratory results, as already said. We have the nutrition lab, the theme. We can also get our data from there. We have the household surveys, yes, no doubt about that. We also have other surveys like the DHS, already mentioned, the mix, and also micronutrient surveys. Those are our sources of data. We also have research databases where we can get all this LSFF data. So these are the existing data sources for our Malawi, Mother Malawi at the moment. Next. Yeah, now in terms of now the existing data collection and management tools, we have paper-based inspection and sample collection forms that exist. We also have the Excel-based national fortification monitoring tools. We also have laboratory testing and laboratory information records, government reporting templates, surveys and research databases, the GFFF that Doreen mentioned earlier on, that also exists here as our data collection and management tool. We also have the digital approaches such as the Fortification, okay, which was already mentioned by also Doreen in her presentation. So all these are some of the data collection and management tools that Malawi has and can use to collect food fortification data, analyze food fortification data, and make decisions based on the findings that could be got from these tools. Next. Yeah, so in detail, you can see what does Excel-based food fortification monitoring tool does. It consolidates monitoring data from inspectors and collection points. It also tracks data by district, brand, producer, importer, and location. It also identifies missing samples and non-compliance. It also generates summaries and charts for decision making, but also provides a foundation for transitioning to more integral data digital systems. Next. For Fortmice, this now provides a platform for digital monitoring. Okay, so for Fortmice, this is a digital inspection and sample collection form. It uses a mobile data collection. It is centralized. It's centralized data aggregation. It also is real time. Okay, real time dashboards and also compliance tracking. It also does that. It also automates reporting by product or by producer or by location. It also has the potential for, it's a potential opportunity for Malawi to reduce paper-based and fragmented data processes, as already mentioned by the DD in his opening remarks. So Fortmice provides us an opportunity for that context. Next. Yes, the GFF, I think I need not to emphasize this because Doreen also mentioned about this, but just to mention that this is an international platform for food fortification information. It includes legislation, standards, food availability, consumption, and monitoring information. It also provides country-level information for fortified food vehicles. It also can complement Malawi's national data systems and also support benchmarking. Next. Yeah, now what we are saying is that from the inputs, we can come up with the impacts. Okay, we have the premix and the inputs at place that lead into production. And then after production, we do the quality control. And then from the quality control, we do the regulatory inspections. Then we do the lab testing. We do the market availability. We do the household access. We do the consumption. We do the micronutrient intake. We do the biomarker status. We also do the health and nutrition impact. So on this, what we are saying is that our key message is we need to connect our data streams rather than treating them as independent data sets. So they need to be connected together, not fragmented, for us to make meaningful impact. Next. Yeah, so although we are saying that we have challenges or we have gaps in our LSFF data system, but at least there are some strengths on our LSFF data system. And what are they? We are talking about the mandatory food fortification framework and national standards that we have. Already that is a strength on our part in as far as LSFF data system is concerned. Number two, we have a government-led monitoring structure in place. Yeah, we have so many structures in place as government that now lead into monitoring of fortified foods, but also data in our country. We also have district level surveillance and sample collection systems in place. We also have the national laboratory testing capacity. Yes, we have the nutrition lab already mentioned at FIM there. We will have that. That is a strength on our part. We also have experience with the national data consolidation, at least as a country. That is also a strength on our part. We have also an engagement with private sector producers. Yeah, we have so many. Ilovo, as mentioned by the DD, Ilovo Sugar. We have the oil producers, rub processors that produce flour, Bakresa, just to mention a few. All those we engage them as a country. So that is a strength on our part. We have the national coordinating mechanism in place. We also have access to international platforms such as the GFDX, as already mentioned, that on our part, this also acts as a strength as a country in as far as LSFF data system is concerned. Next. Yeah. Okay. So, these are the challenges, the gaps that we have as a country in as far as data is concerned. Fragmentation. Oh, sorry. Come back. Come back to the previous slide. Yes. So fragmentation, the DD emphasized on this in his opening remarks. He talked about that our data is there, but it is fragmented. So that is really true. Our data are held by multiple institutions. If you go to my Bureau of Standards, they hold that the data, FIM holds the data, Department of Nutrition holds the data, the industry holds the data, Ministry of Trade, by the public health, in the Ministry of Health hold the fortification data. So it is kind of like fragmented. We needed to have at least maybe a harmonized data system that can easily be accessed and also guide in decision making. Timeliness. There are delays between collection, laboratory analysis, and reporting. Currently, we were waiting for the micronutrient survey report, but the laboratory analyses have not yet been completed. Maybe the DD will comment on this, on where we are in as far as micronutrient survey data is, and also the report is, because it is long overdue. In terms of, we also have challenges on completeness. We also have challenges in limited integration of the industrial production data. We also have limited routine linkages between compliance, coverage, and consumption. We are not doing monitoring at the moment. We are not doing a lot of monitoring on large-scale food fortification, and that gives us a problem to monitor compliance of fortified foods, coverage of fortified foods, and also even consumption, because we are not doing the monitoring that we are supposed to be doing as a country. Weak linkages between LSFF data and micronutrient outcomes, yeah. resources and the sustainability constraints here. That's why we are not doing monitoring at the moment. Resources are not there at the moment. Resources are not there. If they are there, they are minimal, but I can't remember where we got resources and went for monitoring of fortified foods in the country. Next. Yeah, so our data quality priorities are as follows. We need completeness, accuracy, timeliness, consistency, accessibility, disaggregation, but also actionability. So these are our data quality priorities that we need to focus on as a country, that we need to complete. In terms of completeness, all are required records and samples are they submitted? Those are the questions we need to ask. Are inspections and laboratory results reliable? Those are the questions we need to ask as a country. Are the results available when decisions are needed? Those are the questions we need to ask. So, but those are our priorities as a country in as far as LSFF data is concerned. Next. Yeah, so this is our proposed Malawi's LSFF data architecture. We need at least a national LSFF data repository or dashboard in place. We need the industry data, inspection data, laboratory data, market data, household data, nutrition data. We need dashboard outputs. That's in terms of compliance, so that we can measure compliance or non-compliance. We can also measure district trends, laboratory turnout time, coverage, and corrective actions. Yeah, so in terms of users, we already know them. MPS, MOH, FIM, districts, industry, partners, and also national coordinating structures. Those are probably the users of this data that we need to have. Next. So what are we recommending in terms of LSFF dashboard? We recommend sample collection and testing. We recommend overall compliance and non-compliance rates. We recommend compliance by food vehicle and producer. We recommend compliance by district or location. We recommend laboratory turnout time. We recommend market availability and population coverage. We recommend estimated nutrient contribution, but also we recommend that we need to be doing corrective actions that are completed. Next. Yeah, now moving forward, as a country, all of us have a responsibility to play. So we came up with these priority actions and divided the actions or tasked ministries, partners, and also departments to do what we think if we do, we can improve our data access availability on LSFF in Malawi. So our priority action number one is that we need to map all the existing LSFF datasets and tools. And the lead institution here is the Department of Nutrition, and that is the timeline to your right. Number two, we need to develop a national LSFF data dictionary. And also the lead institution should be the Department of Nutrition, and we need to do this by March 2027. We need to harmonize indicators and reporting formats. Okay, and again, we tasked the department to lead in that by April 2027. We need clarification on data ownership, responsibilities, and sharing arrangements, and that responsibility has to be led by the department by April 2027, has to be done. We also need to strengthen our routine data quality checks, and we are tasking the public health department, Ms. Jeremiah, we tasked you this, that you can lead so that we have this quality checks or routine data quality checks and monitoring and all that by February 2027. Developing a central LSFF database or dashboard. The Department of Nutrition can lead in that by July 2027. We need to digitize inspection and sample collection. Obviously, Ms. Jeremiah and the ministry in the public health section, you need to lead in this because you have been doing this and you are the best people to do this. Next. The other action is now linking laboratory results with inspection data. So lab results is the responsibility of FIM. Yeah, so we want FIM to do this by December 2027. Integrate industry quality control information. This one is Ministry of Trade. Okay, because this is now an industry issue. So Ministry of Industry or Malawi Bureau of Standards can also do this by February 2027. Linking compliance data with coverage, consumption, and nutrition outcomes. This is the responsibility of the Department of Nutrition, and it has to be done by July 2027. So these are the things that we need to be checking, or we need to be checked on, whether they have been accomplished or not on the specified time frames. Next. Yeah, so finally, I think the recommendation, I have already mentioned them, but just to mention that these are minimum recommendations that we are making as a LSFF data set. We need a product, okay? We need a geography, we need monitoring, we need action. Okay, so this is our recommended minimum LSFF data set. Next. Yeah, so the key message is that Malawi does not need to start its LSFF data system from zero. Already you have seen, we have something that we can start from. And the country already has policies, as already seen. The standards are there. The monitoring structures are there. The laboratory capacity is there. The district surveillance is there. Existing data tools and all that, they are all there. So we can't start from scratch. We have at least something to start from. The priority is to connect, standardize, digitize, and use this data more effectively. We also need better LSFF data that can help us to make better decisions. And these better decisions that we are going to make are going to make us to come up with better program performance. And obviously, with better program performance, then it means better nutrition outcomes. That is the key message we are giving. Finally, in conclusion, next slide. A strong LSFF data system will improve monitoring of fortified food quality. That's the first conclusion. The second conclusion is that it will help identify where non-compliance occurs and support enforcement. The third conclusion is that it will improve understanding of market availability and population coverage. The fourth one, it will enable stronger linkage between fortification performance and nutrition outcomes. And the last conclusion is that ultimately, the better data that we will have will definitely support faster and evidence-based decisions for Malawi nutrition program. Reaching this far, this is the end of our presentation. We wanted to disseminate to the team that is here. Over to you, Chair. Thank you.
Thank you very much, Chair Son, for the wonderful presentation. In fact, ladies and gentlemen, we have heard two presentations here. What Doreen did was to give us a regional model of what is expected, and also to give us some of the tools that are available that we can use. And what Jason has done is to cement the same on the Malawi context, providing the landscape of the large-scale food fortification in Malawi, again providing us what is available, what we have, and what we don't have. That's what has happened. Now, ladies and gentlemen, to give you a small note here is that if we don't do fortifications, there are consequences that we face as a country. The outcome is micronutrient deficiencies, which are very expensive to treat. Again, some of the interventions we have used to mitigate the impact of micronutrient deficiencies in the country is supplementation. Meanwhile, we have engaged ourselves in IFA supplementation, MMS, vitamin A supplementation. This is also very expensive. and not achievable by any government in Africa if donors don't take part to support. Alternatively, we were supposed to engage ourselves in dietary diversification to mitigate the impact of micronutrient deficiency in the country. But the challenge again is that our soils were eroded, and the plants we grow, the food plants we grow, do not have adequate micronutrients within them that when we consume the dietary diversification, we get everything we need. Again, because of food insecurity in the region, we find the people not having adequate diets, not having frequent diets. Minimum dietary package is not available. As a result, the only way to go is large-scale industrial fortification, where we assume that the people, when they buy the food products from the industries, they will get all the micronutrients we need. That's the only way to go that we see. But unfortunately, we are operating blindly because our data, which we have, is disintegrated. We need to consolidate the data and have it somewhere where it will provide the meaning for our policy shift, policy implementation through strategies that are formulated based on evidence. And the presentation Jason has made has 3 issues we need to think seriously and discuss here. One, there was proposals that were made in the other slide. One of the slides has good proposals. Can you put on the slide, Jason?
Okay.
One of the slide has proposals. The other slide had some action plan. It's a proposed action that we are proposing. Then there was another slide, recommendations. There are all issues that we have to discuss, deliberate here, and see how best as Malawi we can do so that we have a consolidated data that can be analyzed and give us meaning out of it. So with this, can I open the floor for us to discuss the proposals that have been made in the presentation Jason has made, the recommendations that have been made there, and the action plan, starting with the proposals. Maybe we start with the proposals, then the recommendation, then the action plan, because that action plan is a proposed action plan as well. It's a draft, we should say. After this meeting, we need to have a consolidated final action plan that we will all agree and implement. I think that should be the way we should do. Now, by means of hands up, can we be discussing these issues? Unless if Exa, you have anything to say apart from what I've already said. Doreen.
Thank you, Director. I think we don't, but maybe we can invite Dr. Makumula to just guide this session of the discussion. Over to you.
Thank you very much, Doreen and Mr. Mwalo. Thanks for that excellent summary. Indeed, we need to discuss actions that are going to help us move this agenda. We've all clearly heard about the gaps in terms of data collection and data usage or aggregation. So, as a group of interested parties here, what do we see as key areas to work on in order to come to a better solution? I know Doreen talked about Mr. Osman from Rwanda, where they also work on this data and research issues. Maybe if Mr. Osman, you are still here, can I put you on the spot? What is your reaction to what has just been presented? Gareth.
Yes, hello. Yes, you can hear me.
Yes, we can.
Oh, all right. No, thank you very much for the presentations, both presentations, and really key. And yeah, a great contribution to hear all of that. So, not just a quick reaction, and I know perhaps I may react along the way, but as a university, we are committed to provide evidence that the government can use to make decisions. So, because we know that we don't have access to a lot of data sets, we develop tools on our part, on our end, and see what is available so that we can still provide evidence to the government. So with the few resources and what is available right there, we have tried to generate this kind of evidence and answer important research questions that can help to inform decisions as far as large-scale food fortification is concerned. I think since implementation, there's been a gap in terms of the evidence of why are we fortifying what we are fortifying? Are we fortifying the right amounts? And is it really getting to the right, group of individuals who need them? So we try to grasp around these policy questions and try to answer. If we are provided with this kind of fragmented data sets as a university, we are almost ready to answer more, questions, adding to all those kind of aspects. So we are really interested to see where we can get all these data sets. And once we put up all this together, we are able to provide more evidence as a university. So no, that's just a quick reaction to what has been shared. No, thank you.
Okay, many thanks. And if we look at our program, we should be ending in the next 1 minute. But we started a bit late. Maybe with your indulgence and Mr. Mwalo, if you agree, we may have to ask to extend this maybe by another 10, 15 minutes. Is that okay?
Very okay, please, Carol.
All right. And if people have to go, we shall understand. But obviously, from what has been discussed, it's very critical that we hang around and see where we can get this. I would want to zero in on our colleagues from the nutrition lab, Mr. Bitlinu here. We are talking of data for food compliance, data from biomarkers, which is very important for us to make our decision on our success or potential for success. And obviously, you have been busy working on these things. What is your reflection as a country? How do we get to use your data for decision making? Where do you see the gaps from your office side? We have heard about slow delivery of results. How do you comment, Mr. Bitrinu? Have we lost him? Hello, Joseph, are you there? I was trying to check the list of participants. He may not be there at this point in time. Or is let me maybe perhaps move to Dr. Biswick. Are you there, Timothy? Okay. It seems the people that I am picking are not there. Can somebody volunteer? We've heard about gaps in data. Data is available in all kinds of places, but it's never consolidated for us to share as a party of a group of interested people. Anyone, what we may have to do as Malawi? Any suggestions? I'm hoping people have not just logged in and are not available.
No, we are around.
Yes, Gloria. Yes, maybe you can speak on behalf of your colleagues from Chisu. What do you say? Are we getting the data, or if we are getting the data, where is the bottleneck? Why are we not using it to make decisions. What's your take, Gloria?
Thank you very much. I may not answer directly on the behalf of FIM, but maybe I'll just explain the situation. It's like when the food safety officers in the districts collect samples of the foods that are supposed to be analyzed is sent to FIM. The analysis is done at the FIM lab and the results are given. But there was a problem for some time. There were no reagents at the FIM laboratory. Fortunately, last year, UNICEF managed to buy reagents for the laboratory, so much so that they were able to test the samples that were available there and then. And after when they did the analysis, the results were given to the Ministry of Health Food Safety Office, which was my office. We analyzed the results and we gave the results through the technical working group meeting that happens where NFA is available. And that is how far and how much the data went. Speaking on the same data, FIM gets samples from the district food safety officers. Of late, there hasn't been any, for example, in terms of fortification of salt, monitoring of iodine content in salt. UNICEF, some 3 years ago, until some 3 years ago, it used to procure the rapid test kits, which we were giving to all the districts in Malawi, where the health surveillance assistants and the environmental health officers were taking samples. We're testing samples on site, in the markets, in the households, and anywhere where salt is, and at the borders. After that, something went wrong. Fortunately, UNICEF is here. We have never received the rapid test kits for the past 3 years from UNICEF, which was our main donor. So because of that, it's like on salt monitoring, we only rely on the districts collecting samples from the markets and the households, giving them to FIM for the quantitative analysis. Otherwise, we are not giving any information to this forum on salt monitoring that is directly done by the officers in the districts. On the same, because of the shortage of the test kits of the RTKs, it's like the food safety officers in the districts have somehow relaxed, because it's like there haven't been any meetings for some 3 or 4 years now where they could meet and discuss. For 3 years, there hasn't been something like an incentive to say when we do food monitoring, fortification monitoring, at least once in a while we're going to get to a meeting. So this one has been a major drawback, because FIM waits for samples which are sent to them from the district food safety officers. So indeed there is a gap, because the food safety officers need to be motivated to send the samples, collect the samples on quarterly basis from the markets, from the borders, and from the households to FIM for quantitative analysis. Maybe as of now, let that one be the comment. So finally, let me say that the reagents are there at FIM level laboratory, in FIM reference laboratories, but the RTKs, it's now like 3 years, they are not there in the facilities. Thank you very much.
Thank you very much, Gloria, for that. I will ask UNICEF to comment in a while. But you struck me when you said the officers are not doing their work because they don't see the meetings coming. So how do we move it from getting valuable information for decision making, which is beyond meetings? Because yes, they have to meet and share their results, but more importantly, it is at a higher level, and this is where I may want to ask Mr. Mwal when he's finally closing this thing to say what can be done at a higher level to make sure that these inspectors are supported, because we can't make decisions if the inspectors are not doing anything. What channels could be there? Now, as I said, Mr. Mao, you respond to that later. Lusungu, if you are still here, there was also a discussion of monitoring maybe at household level in the absence of regular surveys. Sentinel surveillance studies can be used, and usually UNICEF supports. Obviously, we have a gap there in knowing what is at household level at this point in time. You as UNICEF may have your own challenges in order to support this, but I know you find this as very important. What would you tell the group here as a way out in order to get household information, as well as to sustain this very important regular monitoring at household level? Lusungu.
Yeah, thank you very much. I don't know if you can hear me.
We do.
Yes, I agree with what the colleagues spoke earlier. The data is very important, and I agree also with Madam Gloria, who mentioned the gap in terms of RTKs for salt, for iodine in salt. Indeed, we haven't provided the RTKs to the government recently for a while now. It boils down to funding challenges. But she's right that the RTKs are very important, not only for the regular monitoring, so that the districts can track performance or the quality of the salt that is being consumed in their districts, but also if they have to send the salt samples to the reference laboratory, they can't just send all the samples. They're not supposed to just send all the samples that they've collected for quantitative analysis at the lab. They're supposed to send only the salt samples that have iodine, so that the lab can simply do the quantitative analysis. So the message for me to the Department of Nutrition is that we need to broaden the development partners that are supporting fortification program in this country. For a long time, we have relied on a few development partners. So, like we know that globally there is a very big challenge in terms of financial challenges globally in the international organizations. So, yeah, let's broaden the partners that we have that are supporting the program. I think I should stop there for now. Thanks.
Thank you so much, Lusungu, for that. Maybe just a quick yes or no. In terms of sentinel surveillance, do you see that as a priority now, or how do you see it? You may not have to pay for it.
Yes, sentinel surveillance is very important, and UNICEF supported a number of rounds many years ago, because we can't just the sentinels. We can't just be relying on the DHIS or the micronutrient surveys, which happen maybe after every 5 years. In between the national surveys, we need to still track the outcomes. So sentinel surveillance can give us a quick snapshot of the performance in between the national surveys. So again, it goes back to the same point I was making, that funding is a problem, and we need to be more. We need to be more. We need to be diligent from the part of the government to acquire other partners that can support the program. Thank you.
All right. Before I make my statements and pass on to Mr. Moalo, is there anybody in the group who may want to make a point? The number of us here now. We are still 31 people. Anybody else who may want to contribute to this conversation?
I'm Joseph. I think I'm back.
Okay, thank you.
Possibly,
Welcome.
yes. I think I was traveling. I had network. I think suffice to say that I've heard Sungu very well. I think the issues of surveillance that you have mentioned, if all wishes were horses, surely I think that's the best way that we can do. And as a lab, we are very strategic through the support that we are getting from UNICEF, through the very collaborative initiative that we are having with our colleagues from the nutrition department. We are also geared. We feel like we are not really being fully utilized, and we wish we could do as much more as we can, so that we can also contribute to the health of the people in this country. So if the surveillance was really intensified, given the resources available, that could have been ideal for this country. But currently, as Rusungu mentioned, we have kind of depend on the DHSs, which actually come every 5 years, which is not good. And we also need to do intensify market surveillance, just to make sure that, you know, whatever people are consuming on the market, be it salt, be it what flour, it's that of good quality. I think this is the reference lab. We can contribute working together with our colleagues in the nutrition department. I thought I should mention these sentiments. Over.
Thank you very much, Joseph. And I might just add, for those people who may not be quite aware, CHISU, the Nutrition Lab, is really a service provider to large-scale food fortification. They get the samples, test them, and then they push the results for people to make decisions. And food fortification is a nutrition issue. My experience in a number of areas and countries is nutritionists seem to have sort of jumped the ship. They don't go back to find out where we are. And now it just becomes a glorious issue at environmental health and Joseph at CHISU. But generally, us as nutritionists, we should be saying where we are. I saw a representation here of anemia among women, about 30%. That should be pinching us and say, oh no, what can we do? And where are we now? Food fortification can support. It should be an issue of saying, now, where are we? How good is our salt? How good is our sugar? We have done a survey now. This is almost getting to a year. The results are not out. We should be itching to say, come on, let's see where we are, you know, and celebrate or make decisions to move on. So I just want to call upon all of us here, and of course DNH here, to take keen interest in these results that are being generated, or try and work out some kind of forum or be participating in a way that we can be making quick decisions about our success or potential success in fortification, and make decisions where it is necessary. At this point in time, I would want to pass on to Mr. Mwalo for his final reflections, and then take us to the close of the meeting. We are now 15 minutes beyond time. Over to you, Mr. Mwalo.
Thank you very much, Bwana Makumula, for the discussion. I wish to first begin by commenting on the issue which you brought to say, what do we do with these people manning our borders? I think this has to be put in the action plan, which was presented by Jason. We need to populate it based on the comments from the people around it, and then circulate for the people to comment. Because of time, we would have discussed that action plan, because I was very sure that it should be our take-home issue from this meeting. Because we cannot just conclude this meeting without something to action everyone, so that we see how we progress about large-scale food fortification. Now, because of the time issue, we will sit down, repopulate it based on the comments. Then I'll ask Jason to circulate it so that all can also comment and input into that document, which will be our now working Bible on large scale food fortification in Malawi. We will use that document to see to it that at the end, we have a consolidated database for large-scale food fortification, which can be used for our plan of action and in order to mitigate on the impact of micronutrient deficiencies in the country. That's what we can do. In this, I will ask EXA to make sure that you don't leave us, alone in this, because we will need a couple of funds to facilitate the actions that are on that work plan. Yeah, we will need you to also to influence our partners, which you can reach out to facilitate the financial support for us to make progress in the action plan. Now I've been asked to make closing remarks since we are already in injury time. What I can say is to thank everybody across the board. I saw we were 33 in number. This is a very good, outcome of this meeting, that we were all interested in it and we showed full participation to it. And next time we go for a webinar, please let's participate. Large scale food fortification is the way to go, because the other interventions that mitigate the impact of macronutrient deficiency in the country have proved to fail, have proved to be very expensive. It's only when we persuade the companies to fortify food products, which now Malawians are used to be buying products from manufactured by companies, is a way to reduce macronutrient deficiency in the country. I'll give you an example of sugar fortification, which we started in 2011. When we were studying macronutrient deficiency, the vitamin A deficiency was around half of the population being deficient. After studying it in 2011, a couple of years later, we measured vitamin A deficiency. It was 3 or 4%, showing that large-scale food fortification is the way to go in this country. Salt, we iodize our salt using iodine. We do that. And because of that, the influx of goiter and other deficiencies that come because of iodine have reduced. You scarcely see a woman or man with a goiter now because of those interventions. They seem to work. There are interventions that are showing that they are working within our society. So this is the way to go, and we really need to be very serious about large-scale food fortification. Once again, let me thank EXA for facilitating the Malawi nutrition gurus, particularly fortification nutrition gurus, to congregate today and discuss and see with their own eyes, listen with their own ears on what large-scale food fortification is all about, and what strides we have made as a country in doing this, and why we are still working blindly. Why do we have data not consolidated? They have witnessed themselves. All we have to do as a lead department now is to make sure we don't, take off this fire which has started. We just increase the debris to make the fire burn greater than this. That's what we will do. So thank you on behalf of my government. Thanks, EXA, for coming to our rescue. And we urge you to continue to be with us. Don't leave us alone. Let's work together in this thing we have started. And thank you for choosing Malawi. I know EXA is in about 8 countries, if not 11. You are in 11 countries, but you made sure to choose Malawi to do this. Then we are very proud of you, EXA, for thinking about Malawi. Continue thinking about us in anything that comes along your way. Think about Malawi first. I know there's a reason why God is leading you that way, because that's where bigger problems are within this region. If Malawi goes up in this region, then every country in the region will also go up. We thank you very much for this. And once again, thanks everybody for opening your airwaves to listen to this, to participate to this discussion. All the best as we go. Thank you very much. We did start with a prayer, we end as such, but God bless everyone. Thank you very much.
Thank you.
Thank you. Bye-bye.
Thank you. Goodbye.
Thank you so much. Bye bye. Thank you.
Thank you.
Thank you and
Thank
bye.
you. Bye.
Thank you. Bye bye.
Much appreciated. Thank you all.